Social science microsimulation, a tool for applied healthcare research. Systems are made out of smaller level units. Cars and roads make it a road network. Molecules in chemistry. In social science for us, people, household, businesses. That's what it's in economics and societies. Macro outcomes is, however, what we're interested in policy. So how do we model macroeconomic, macro-social outcomes? And there are many ways, but let me put it into three big clusters. The first one is macro modeling of macro outcomes, and that's what we learn often in macroeconomics initially, where we talk about GDP, where we talk about the unemployment rate. Have you ever run into a GDP in your life or an unemployment rate? No, they are abstract concepts that don't really exist. There's no real, tangible GDP. These are abstract concepts. Total births and deaths, yes, they can be macro outcomes, but they're also individual outcomes. These are typically modeled with time series and have been, or the Keynesian models. That was extremely popular in the 1940s, 1950s, 1960s. These type of models in economics fell out of fashion probably around the 1970s, where we're modeling aggregate macro outcomes with macro data. There's a completely different world where we model macro outcomes with differential equations. That is engineering. That is chemistry. That is physics. Scientific computing, my son is a chemical engineer, atmospheric scientist. He has a degree in scientific computing. That used to mean you solve differential equations. So we have the predator-prey, the infectious disease model, and that works really well. Even if you think about microconnections, if the micro units you care about are all about the same, they're molecules, and they're very mixed in a non-spatial world. So you have perfect mixture of identical units. Well, if I look at this room, you don't look that identical to me, right? So are these differential equations models the right approach for social sciences? Probably not, right? So they work if the microconnection, if you have infinitely close to many micro units that are really identical. Which brings me to micro simulation of macro systems. And that's what I'm doing. That's why Jakob has me here, and that's what he's working on with other researchers, where we have macro level changes that results from the action of micro units, which is the firms, the individuals, the laborers, the couples, families. And we simulate the behavior of the micro units, and then we aggregate. So often the micro behavior is better understood than the macro behavior. Because, you know what, we have a feeling about how people behave, but we don't really know how a GDP behaves, because we've never seen one. We can also, and that's always I've been interested, how distributional effects of policies, so in the effects of heterogeneity, the distributional aspects, that works better with microsimulation. There's no best approach. It always depends on your application and the data availability. So I'm doing microsimulation, but it doesn't mean that I'm denying the relevance of the others. It depends on your application and your data, and then use the best one. Sometimes it's best to start building a macro model, faster, lower data requirements, later develop a micro version. And you can do that once you understand your topic better, once you understand your data better. Start simple, make it more complicated later. In many areas, there are parallel models. Sometimes one is better, sometimes the other. Sometimes they just run parallel, and it's good to compare them. If you never heard of microsimulation, the classic paper is Guy Orcutt, 1957. So computing aside, this is not a brand new idea. Here's the reference. He called it a new type of socio-economic system. He was at the Urban Institute. Surprisingly, a lot of the simulation type models don't come from universities. They come from think tanks. Guy Orcutt was at Urban. Tom Schelling was at Rand. So his argument was, macro models do not model distributional effects, right? We know that. And if you care about popular distribution, we got to do that. Macro requires restrictive assumptions about how individuals behave in order to be able to logically aggregate it. If you cannot logically aggregate it, well, what is the basis of the macro models? What else we have? And we have the stable relationship at the micro level, but we have unstable relationship between macro variables. And I want to give you one example. Body mass index and health, right? If I ask you what's the relationship between increasing body mass index and health, everybody would say, oh, it makes things worse. Well, no. It depends. The relationship at the macro level between population, BMI, and health changes. Ukraine 1930s, well, increasing BMI would have been a wonderful thing. Czech Republic in 2025, maybe not so much, right? The idea at the micro level is very well understood. If you're really thin, gaining weight is good. If you're obese, it's bad for you. And this is not a new insight. This is Shakespeare, 500 years ago. He was aware that obesity is a problem, right? This is from King Henry IV. You see, I have more flesh than another man and therefore have more frailty. Yeah, that sums it up. This was a time where increased population BMI would have been a very healthy thing. So, let me dive into the terminology briefly. Microsimulation or agent-based model. You hear these two terms, right? They can be the same or different. Both deal with micro units, agents' behavior that are aggregated to a macro behavior. Where I make the distinction, and that would be some organization like the International Microsimulation Association would use the same thing, is I consider agent-based models as models that are more theoretical. They are abstract. They have little empirical content. They have surprising insights. Insights. I'm glad you're native speaker, not native speakers, so I can misspeak without being too embarrassed. Insights. Okay? Surprising dynamics. Whereas the microsimulation, so agent-based model, whereas microsimulation is implied, empirical. There are more limited dynamics and interaction. That's a common distinction. It's not universal. So let me show you, after I showed you the founder of microsimulation, basically one of the founders of agent-based model. And this is Tom Schelling. And Tom Schelling's model, this is a RAND memorandum, 1969, Models of Segregation. Tom Schelling later on got a Nobel Prize for it. And it's this model, and I'm going to pull it up and run it for you. This is the best-known agent-based model. Yeah, I'll show you. So the story behind it, for those of you who have not heard behind it, he was asking the question, why do we see segregations in neighborhoods? Are people inherently racist? And so he started simulating, not with a computer, with paper and pencil and coins. What happens if people are really not racist? In fact, people like living in diverse neighborhoods, but they do not want to be the only person in a neighborhood where everybody else is different. They're perfectly fine to be in a minority. What happens? Does segregation appear? Let's do it. So if you want to do any simple agent-based models very quickly, you go to netlogoweb.org. That's a little software package where it's very easy for you to build your own agent-based models. Here we go. If you go to NetLogo, you get something like this once you build a model. So I told you we want to have a society where there are lots of people, they live somewhere. We start off with a complete random mixture. And people are not racist. They like to live in a nice neighborhood. Say they're happy if 30% of their immediate neighbors are similar to them, and 70% can be completely different. Let's populate our world. Here's our world. You can see some empty spaces. These houses have not yet been built. And so we assume there's some people that probably just feel too isolated. They want to move somewhere else. And other people who at least 30% have similar, they want to stay. So let's move once. Things change, and we can move and move and move. Let's do it many times. We'll move, and whoops, we converge to segregated neighborhoods fairly quickly. Let's see, was this a random effect? Let's set it up with a new population. Let's do that again. oops, converges rather rapidly to segregated neighborhoods among people who actually are quite happy to live in diverse neighborhoods. Now, what about a racist world where people really, really hate not having the majority of neighbors being the same as they? So let's say we want similar wanted, we want to have 80%. We can tolerate this 1 or 2 Roma people in our neighborhood, but no more than that. Go. And we keep going, and we have a society where people are unhappy all the time where they live, and they keep moving, and they never converge into anything. So very different. This is an astonishing insight. And well, Tom Schelling was a brilliant guy. And if you're a truly brilliant guy, you can develop these type of models and get insights. I'm not that brilliant. I stick to data and empirical research. So Tom Schelling got a Nobel Prize. And yeah, well, I won't. So I told you about the microsim that are empirical, and Tom Schelling himself, he wrote about this agent-based model. These models are so abstract that nothing will make them look like reality. Their comparative advantage is in the direction of simplicity, of qualitative insights, not guiding policy. If you want to guide policy, let's switch over to the other world. Microsimulations, they take a different route. Therefore, quantitative results, they're empirically based. They can have more complex and varied transitions, but the feedback is not as complicated as in agent-based models. So they're less surprising. Let me give you the prototype. You want to be a modeler and you want to be guaranteed to have a job in microsimulation. I have a job for you. It's taxes. The static tax model is you take a proposed new tax schedule, you feed in a sample of taxpayers, you calculate for each individual the tax effects, you spit out the total revenue, you can spit out by population subgroup how much their new tax burden is. Works great. Is this boring? Yes. Is this tedious? Yes. But this is what policy analysis, that is the type of policy analysis that decision makers actually want from you. Right? Now you can hide in a university, but if you're not hiding in a university, that's what the demand is for. Can you really give us a good? We want to write a new law. Give us what the distributional effects is on this type of family of this. Right? Okay, this is too boring for me even. But one of the classic models would be the Euromod. So you get a new policy rules, you grab the data, you run the black box, and out it goes. All right, this was the introduction for what microsim is. Now let me make a detour and I tell you who I am. My training was a PhD in economics from Stanford University, and I specialized in statistics, econometrics. Really all my career, more than 30 years, I've been at RAND. And RAND is a think tank. RAND is not a university. It's different. It's a research institute that comes up with new ideas that could influence public policy. So for us, it was always one of the requirements at RAND is you got to report in your thing, not just how many papers you published in what journals, but what is the policy impact? Did anybody actually care about what you published? It started in 1948. Really Cold War stuff. The US is the largest funder. It supposedly has been growing really rapidly, but roughly magnitudes 2,000 employees. And we have a graduate school, and there's one graduate from that school here in this room. So it's a PhD program in policy analysis. This is how the building looks. That's how it looked, because that was the old building. I started my career there. This is now a park. This is the new building, and we're very close. And you might recognize the pier if you ever watched movies, like movies of car scenes that go into a pier. Well, it's the Santa Monica Pier. So right there. So my students, now I want to tell you a little bit about my students because I'm immensely proud of my students. Rupeng An was a Chinese customs officer before he met me. And now he has an endowed chair at New York University in health data science. Brian Theisinger, you will meet shortly. He's now the director of health simulations at the University of Southern California. You want to ask somebody about specifics of the future elderly model, Brian is the person to go. He did his dissertation with me to develop a related model to this. Annie Chan is a more recent graduate of mine. She developed a microsimulation model for Taiwan, basically using the same architecture that Brian used in his dissertation, and that Jakob is now bringing here to the Czech Republic. And then I had a space for a fourth person, and I wanted, well, obviously 2 men. I needed a woman, and I needed her from a different continent. I had a number of choices. Tatiana Andreeva from Ukraine, and Nelly Mejia from Mexico. This is Silvia Montoya from Argentina. She's now the director of the UNESCO United Nations Institute of Statistics. So this is kind of my students. They all do empirical research and tend to be in the simulation world. Let me go on another detour. I say short detour, but my detours can be long. About statistical learning, I like to call, I don't know what terms I like. I like the term statistical learning. We grab data and we want to learn from this data. I'm not here to prove a theory or a fixed idea I have. I want to learn something about the real world. That's why I do data analysis. Data are noisy, data are random, and data, most importantly, they're too large for human brains to wrap around. We have millions of observations. We can't do that. We need to compress them somehow. And that's where statistical learning comes to. There is no magic. Okay, let me repeat this. There's no magic. People these days want the magic. They flip the artificial intelligence switch, the machine learning. There's magic appearing. No, there isn't. Analytic tools cannot create insights from uninformative data. They can create only nonsense. So practice your English. Repeat after me. Data always come first. Data always come first. Yes. And that is really a pretty deep belief here I have. So, as you may have heard, data comes first. So, data size, quality, and substantive questions determine the tools. It's not the tools that drive your analysis. It's the data that should drive your decision of tools and what you can do, right? Tools do not need to be complicated. Start with descriptive statistics and with simple regression models. And I had jobs for you, and where is she? Somewhere else. They're pretty simple descriptive. There, over there. They're fairly simple statistics. They're not that simple regression models, but they are simpler, and they're prediction models. And even I asked you to take out some of the complexities that you wanted to start with. We start simple, we build up. That way, you actually learn what limitations are in your data. It often clarifies what your research question really should be and what simulation models and approaches are promising. So when I say data first here and the question, let me do a little caveat, because there are different statistical learners. I want to answer policy and business questions. There's a whole other world of AI and machine learners who want to improve labor efficiency by using machine learning AI so people don't have to think, right? And saves jobs. So there's a different area of work. I want to learn about and answer policy questions. Then after data first, after data, science and substantive knowledge. You need to think about what you want to do. AI cannot formulate policy or research questions. Don't go to ChatGPT to ask you for a research question or even have a description of a research question. You do this. AI cannot even learn established facts easily. There's never enough data to train an AI without some very strong guidance. But as I said, in most real simple situations, you don't need the fancy tools. Do something simple. Simple analytic tools or simulation models are sufficient, especially if that's all that is supported by the data you have. Data first. So I'm an economist, but I'm not the only person who has developed it. In fact, in the hard sciences is now a new area that is sort of science-informed machine learning and science-informed AI. My son made his career as an AI machine learning person. He's a chemical engineer, atmospheric scientist, and he has sort of a little paper he did recently. Search for the title, What Artificial Intelligence Can Teach Us About the Air We Breathe and What We Have to Teach It. And his point here in this op-ed or description of why he is studying is it's very hard to learn chemistry, But for AI and machine learning, it's even harder. You have to teach AI chemistry. You have to teach AI physics. First, don't hope that AI, by feeding it a lot of data in there, will learn physics or chemistry. It will create nonsense. Summary of my introduction and my detour, and then I go to the substance of the course. Statistical learning about the world. That's what I'm doing. The information that we're looking for is hidden in the data. It's hidden in the data. And we use statistical learning to get that information. Now, sometimes there is no information in the data. Too bad. But no matter what, you're not creating that information with the tools. It has to be in the data. Data first and conceptual thinking next. Not a tool. Start with the basic. What I think of simulation, it's more than a toy. It teaches us. We play around with it to learn something about the world. Simulation is purposeful model use. We develop a model and then we play around with it. That's different from having a model and you estimate it and you report long tables of regression coefficients and you hope you get published. I want to build a model and then play around. What does the model here do? It's about solving problems. It's about finding explanations, building theory, predicting the future, and really raising consciousness about the substantive issues that we're dealing with. I also think, I don't think I have been super successful, but I have my hope on Jakob that he can do it. Train policymakers to improve their awareness of policy effects by adopting some of the simulation tools. How do pilots are trained? Do they fly jets immediately? No, they get on flight simulators and try out things. And then they get let loose on the real world. Let's do that for policy as well. Microsimulation advanced. There are a bunch of microsimulation models. The compare model is one for health insurance. There's a group that does modeling for cancer, a very clinical type models. There's the future elderly adult model, and you will hear from Jakob, and if he has future guests here, Brian Theisinger, you will hear a lot more about this model. There are a whole bunch of other models. My main project these days in a different area, it's in modeling diabetes complications. I'll tell you more about this model. If you see a new model, think about how you can classify it in terms of characteristics, the dynamic or static. FEM is a dynamic model, the text models tend to be static. Is it discrete and continuous time? You're running discrete time in 2-year intervals. A lot of the cancer models would be continuous time models. Are the parameters estimated coherently from the model? You are doing this with the shared data. In many microsim models, they take parameters from the literature and then try to somehow calibrate it. Ooh, it's not an approach I like, but it's an approach that's very common. And then do we use actual individual characteristics as you do using the shared data, or do you create completely artificial types? But this is sort of how, if you see a microsim model, think about these classifications. Here's the future elderly and future American models, which really was developed at Rand 20-some years ago. And that's related to population aging based on panel surveys. And here in Europe, yes, you're right in the center here of Europe. You have the SHARE, which is an aging survey across a whole bunch of countries that looks at people 50 plus and follows them over time. And that can feed into a simulation models that hopefully gives useful information to governments what to plan for in the next 10, 20 years. And you're not alone in the world now. You're not alone. There's actually a whole bunch of countries that are doing exactly this. And the biggest one, of course, is almost the US or so. And some of the models that are, it says in progress, but my student, Annie Chan, she developed the Taiwan model. It's running with on Taiwan. Do I believe results from it? Not really, but it's running. And the deputy minister of health from Taiwan has seen it and she likes it. Should she make decisions based on it? Probably not, but it can be developed. The future elderly model, because you'll be using it, let me give you the basic idea of this. The basic idea is you have an individual who might be 50 years old. What happens 2 years down the road for them, and then 4 years? When do they develop a new condition? When are they getting so sick that they need to go to a retirement home? So we estimate the transitions from the longitudinal data, and then we calculate forward the trajectories. And it's a simulation. We don't really know what the trajectory is, so we take individuals and run their lifetimes over and over again. So 50 now, 52, 54, 56, you get a heart attack. Okay, we start another life for it. You simulate different life trajectories over time and eventually summarize over your population. Now, what you can do, and that's where the policy simulation comes in, you can consider different counterfactual. For example, what happens if you can now redeem magically, which there is a magic drug, it's semaglutide, the Wegovy Ozempic. You can lose weight very fast and effectively at very high costs. So is this cost effective? Not. I think these models can help us to do it, but we have to improve that diabetes part. That's my other part. So, and then you can calculate the outcomes for the counterfactual society. Whenever you have a model, look, you start with concepts, right? You want to start with your concepts. What is the predictor of the outcomes? What are the outcomes that you want to predict? And what are the outcomes that are happening at the same moment as something? These concepts is nice, but the real action is how do you make them operational? So you need to operationalize the concept. A is just a concept. It could be modeled as a linear function, as a quadratic. Let me tell you, neither one is good. You can use splines, as you've seen. I like the splines idea. You can do H categories. So the operationalization is quite important. This is kind of how it works in the future Americans. So you have a model that is for people 50 plus. I have a whole US population. So you start with a cohort here. You simulate the policy outcomes that are there. Then they age forward. But now, since they age forward, you have to add a new cohort. And as we know, the new cohorts that come in are getting smaller and smaller and smaller because we have low fertility rates. But now you have a new population, you do that, you run it forward, and so you can do that 10, 20, 30. Nothing prevents you to run this model forward for 50 years or 70 years. Although this is pretty much nonsense what you get. But for 5, 10 years, 15 years, yeah, this is probably as good as a time series model once you validated your model. Two applications here. So 2 of my PhD students used the model. Both used other sources of information, but this is how you might be using it in the future. One used a trial, the other literature assumption. I would say the results are more speculative than they look, and I like these models, as I told you, to learn something about it, simulate it. I use these type of models as a complementary tool to an empirical research project. It's not for me the main thing. I do a research project and I add this to it. So one of them was an experiment that we did for the Food and Drug Administrations because they had to implement menu labeling regulations. We did an experiment. What would happen if, well, not what happened, because the regulations did happen. As soon as our study was published, the FDA commissioner put the regulation in place, and our study was the only one cited for it. But it was really a randomized virtual experiment. And then she used the results from the virtual experiments and fed them into the simulation model. And so what she would find that the BMI would be stabilized a little bit earlier, that diabetes rates will still go up. No, menu labeling is not going to stop the diabetes epidemic. It will go on. You can say it makes a dent in the long run, but you still would have to run it for. Now, you may ask, why did we start it here? Because the regulation should have been in place in 2010, because it was part of Obamacare. So there was a law in 2010 that said the menu labeling should be in place. It didn't happen until 2018. So that's a different story. And the other part where we did an impact of a nationwide soda taxes, and she did a policy intervention that assumed a 10% price increase. And now, in this case, we did not have the empirical data. So she had to go up from a whole bunch of different pieces that she had to get from the literature, make these assumptions, and then finally fit them into the model. And basically what she would say is, we get a lower burden of chronic disease over time. This is the scenario you'll be running pretty shortly. Last couple minutes, 5 minutes, let me talk about my current project, which is modeling diabetes complications. And I gave some of you the pitch about you want to model diabetes. Diabetes is a common condition with long-term effects. In the US, about 15% of adults and 30% of adults over 65 have diabetes. There's a rapid increase of diabetes with obesity. And moreover, with extreme obesity, which has been increasing much, much faster than moderate obesity. So the big problems are still in the future. They still haven't happened yet. In the US, currently, not in the future where things get worse, currently related healthcare costs to diabetes are $300 billion US. Well, $300 billion, that's the Czech GDP for magnitudes. That's a big chunk of money, even for the US. And it's about the healthcare costs and disability part. It's more about morbidity, being sick, than about mortality. You know, smoking didn't have that problem. Smoking, cancer, people are dead. Here, obesity, diabetes, long-run chronic problems, lots of additional complications, amputation, blindness, renal failure, dialysis, and then death. In fact, it's so big that even diabetes research is a big business. There are dozens of companies that focus on diabetes modeling. There were some impressive analytic models. I'm happy to talk to you about all these additional models that exist, not mine, others. There are even conferences that are just about diabetes modeling. There are dozens of companies that sell these products. If you go back and look at a systematic review of the most common models, there were 19 of them, 16 of those use exactly the same old data. And moreover, that data is from a trial in the UK that started in 1977. Sounds like a joke, right? It's not. This is how a lot of decisions on diabetes are made, based on a trial from the United Kingdom that started in 1977 with 5,000 people. That's it. It's a great trial. It was a brilliant trial. But it's 2025. The UK risk engine, it's a microsimulation model itself, and I'm running that. Oh, I can go on for hours here. But I tell you what I'm doing right now. What I'm doing now is develop a new model for diabetes complications, working with a health plan, Kaiser Permanente, where we have electronic health records. And these are different from your claims. These electronic health records have all the measurements for all the lab tests. They have BMI, every doctor visits. They have the blood pressure at every visit. So it's very different from claims. It's a very comprehensive database. And what I'm doing is I want to validate, create a new risk engine, validate it, and contrast it with the UK PDS. So this is a health plan in Southern California. If I just look cross-sectional, I get 630,000. This is just Southern California, right? One health plan in Southern California has 600,000 people who were diagnosed with diabetes as part of their plan. I want to create a longitudinal cohort, and who did I tell you about longitudinal cohort? Mathieu, right? So I grabbed a longitudinal cohort with 157,000 people, and then follow them over time. I limit to new diagnosis in an outpatient setting, and to people who are less than 75. And also, I used all the data that are necessary to run the UK PDS engine. So we put this grab this cohort, put it in the UK PDS, and run 10,000 lives for each individual. So some of you who think about, then what do you call it, repetitions? You're running 10 repetitions, right? Something like this. So I'm 1.5 billion lives I'm simulating here. And then I calculated the Kaplan-Meier survival curve, which is the probability that we don't have an event over time. So what do you expect? Mortality. Actual mortality versus UK PDS. Well, here are the results. The blue is the actual mortality of the people. Putting the characteristics of these people in the UK PDS engine gives us a much stronger one. This is what informs pharmacoeconomics. All the claims about drugs and so are based on simulations from this model. What happens to myocardial infarction? No surprise either, because we know myocardial infarction has dropped substantially. But the UK PDS model does not reflect it. UK PDS still has this very strong effect of myocardial infarction among people who were diagnosed with diabetes. This has dropped a lot. And we talked about the statins. It's the statin story. There are some conditions where actually the UK PDS still works reasonably well for stroke. There are some situations where UKPDS looks like it's not working very well, but it's only because it's such a rare event that it's really, is it such a rare event? 5%, it's not such a rare event for amputation, so we can go on for a long time. Let me summarize. Microsimulation is an alternative when simpler tools no longer work and you have good data, and by now you have a good idea about what you want to do. Data comes first. There's really no good model without good input, and getting the data can be the hardest part. Importantly, data and models age. And once you build a complicated microsim, there's the temptation to hang on for dear life for this. And the model ages faster than you are. And so I suggest often, time to give up the model, let's build a new one. What next? Let's build new models. That's really what I'm in favor for. What data do you have that could support new risk equations in the healthcare field or anywhere else, social security? There are lots of questions. What data do you have where you could build a microsim model? What we need from the programmers is better interfaces and transparencies. One of the problems of the microsim world right now is these models are black boxes, undocumented, terrible interfaces. These are big. Why? Because these are still legacy models that were developed 20, 25 years ago. People didn't think about computer visualization, graphics. So the new models can be done better. It's time to rebuild them. Finally, it's make the models useful for decision makers to train them. That's where also the computer visualization, the good interfaces come in, because otherwise they're not going to use those models. But make this for decision makers. Look, a US senator won't use it, but the staff of a US senator would use these models. And I'm not sure what the equivalent here is, but there are legislative analysts that probably would want to use this. But you have to make these models useful for them, and you have to train them. That's where maybe a health innovation institute might come in handy. And think about the analysis of a flight simulator. Just like you don't let people fly planes, train policy, maybe have a degree program that teaches how to do this. So, okay, thank you for your attention.